Welcome to our eye clinic channel. My name is Dr. Lucy, an eye doctor, and in this channel we teach you about different eye conditions and diseases, the products, and where you can get help. Feel free to drop your comments and questions below. We post a short video every Tuesday, so just click, listen, and learn. In this episode, we will discuss how COVID-19 infection affects the eye. As you're aware, the number of confirmed cases, COVID-19 cases, are on the increase in most countries, including Kenya. We therefore do not know how this curve is going to look like in the next month or two. Therefore, let us continue to learn more about the disease. So far, what we do know is that the respiratory system is most susceptible, but other tissues or organs and systems have also been affected. And the common factor here is that we have a mucous membrane. The mucous membrane is what protects the body against certain external elements, including infections and chemicals. The white surface of the eye and the inner eyelids are also lined by mucous membranes called the conjunctiva. If you turn your lower lid downwards, the pink membrane is the conjunctiva. It turns red when it is inflamed by certain microorganisms. So, how does the virus get into the body and to the eye? Spikes of the virus hook into cell membranes of the human cell, and then they pour their genetic material into the human cell. This disrupts the function of the human cell, and the virus continues to multiply. The cell then bursts and releases the new viruses, which continue to infect other cells. A single virus can churn out million copies of virus before it actually dies. So how does the eye get infected or affected? The eye gets infected through the conjunctiva, and we call this conjunctivitis. It can also get infected through the bloodstream from other infected tissues, and therefore conjunctivitis can be a symptom of COVID-19 infection. Remember also, on average, we touch our faces 2 to 3 times per minute. You can imagine the number of times we do this in a day. So it is very easy to transmit this virus to the eye. It's not quite clear how many patients have been affected by conjunctivitis due to COVID-19, but studies have reported between 0.8 to as high as 31%. And what they have pointed out is that this is mainly in patients who have severe disease. Conjunctivitis is a common condition that we see in eye clinics every so often. It can be caused by many viruses, many bacteria, and even chemicals. In fact, the commonest cause of conjunctivitis is allergy. If you have conjunctivitis, therefore, it does not mean that you have COVID-19 infection or vice versa. But if you have COVID-19 conjunctivitis, you may have symptoms like any other conjunctivitis that include redness of the eye, swollen conjunctiva, itchiness, tearing, or such things. Other effects of COVID-19 in the eye may not be apparent right now because the number of those with eye infection is very low. Studies are still being done. Therefore, as the disease evolves, we may see more and more, and we'll certainly keep you updated on this. And therefore, even if the risk appears very low, let us protect our eyes by following the Ministry of Health guidelines that you have been told. And the other thing is, do not touch or rub your eyes. If it is difficult to do this, use your clean hands and tissues, or clean tissues that you can actually discard. If you do need to see a doctor, call the doctor beforehand to tell them what you really, to ask if you really need a face-to-face consultation. Inform them of any other symptoms that you have, like a fever, cough, or difficulty in breathing. But if you do go for the consultation, take all the necessary precautions that you have been told. But in addition, avoid touching surfaces and also take as minimal time as possible. Remember, we still do not have treatment, and all we can give is actually just supportive treatment. So that sums up infection of the eye by COVID-19 virus. Thank you for watching. As I said, we do post a short video every Tuesday. So do subscribe and hit the notification button so that we can alert you every time that we upload our videos. In our next episode, we will discuss allergic conjunctivitis, a very common condition, especially in children, that can lead to decrease or even loss of sight due to some complications. I'll see you next Tuesday.